know you've seen the terrible headlines about nursing home abuse, about patients not getting the care that they need, getting horrible wounds, and being abused by staff. Nursing homes have a really bad rap these days, but I know for sure that you're only hearing the negative stories. You might have a parent who needs nursing home level of care, but you are so terrified of all the nursing home stories that you hear that you are keeping them at home under your care, even when it's more than you can handle. And there is no shame in that. Because what are you supposed to do when you feel like your only option is to take care of your parent, even at the risk of your own physical and mental well-being? Well, today, I'm going to shatter some of the myths about nursing homes and let you know how you can find an exceptional one. Hi there, I'm Sofia. I help adult children decrease their stress and emotional overwhelm when it comes to parent care so that you can focus on just loving them the way that you want to. And yes, I absolutely have to admit, the care at a lot of nursing homes is horrible, and you have to be really careful about the facility that you choose. But you know what? There are 15,000 nursing homes in the United States, and not all of them are a nightmare. So in this video, I'm going to tell you exactly how you can find that exceptional nursing facility in your area. And right now, if you're thinking how crappy I am for making a video like this, because everyone should stay home and take care of their parents, and if you think that people who put their parent in a nursing home are unloving or don't care about their parent, then just stop a minute. This video is not for you. My channel is probably not for you, and I'm not for you, because you are a shamer, and there is no shaming allowed here. I think that everyone has a unique story, a capacity, a means, and an ability. And I'm here to help everyone no matter what. So shamers, turn this off. The rest of you, let's keep going. So yes, we're going to dive deep into this topic. But first, if you're really serious about getting off the emotional roller coaster of parent care, then you should check out my new masterclass that I made just for you. Learn why, even though you're doing everything you're supposed to do for them, why it still feels so bad, why you're still stressed and frustrated. Find out why what you're doing isn't working and what you should do instead, so you can have some peace in parent care and fall back in love with your aging parent. Go ahead and get immediate access at sofiaamirpoor.com/masterclass. I'll put a link in the description. So let's go ahead and dive into nursing homes. I think that there's going to be a lot of new information here for you. So we're going to talk about the facility 5-star rating system that Medicare uses on every single licensed nursing home in the United States. And yes, I have heard people say that this system, it's too easy for facilities to cheat on and misreport data, so the ratings don't mean anything. Well, I'm going to tell you that this is just a tiny bit true. But we're going to talk about how they get these ratings, and I'm going to tell you how you can do your own deep dive into the facilities in your area. So yes, facilities do need to electronically self-report some data on a regular basis on things like wounds, infections, and psychiatric medications, among other standard things. And yes, it's pretty easy to fudge on that data. However, that is not the only way that they come up with the ratings. That would be really stupid. So every single year, every facility gets a surprise, unannounced visit from the state inspectors who conduct annual health and safety surveys. I'm talking about a team of 3 to 8 people, depending on the size of the facility, who will come in and infiltrate that facility for 3 or 5 days or more. The more things they find wrong, the longer they're going to stay. These are seasoned, very experienced professionals. They're registered nurses, doctors, pharmacists, infection control specialists, and others who are there to protect the residents from fraud, abuse, neglect, and to promote quality care. During the time they're there at the facility, they go through everything. They follow many different staff for days while the staff are providing care and giving medications or doing therapy. They audit charts and interview residents and family members. They dig into the medication carts and they go in the kitchen where the food is kept and stored. They audit the soiled laundry and the Foley bags and the suction canisters. They are definitely reviewing everything about the wound treatment at that facility, the appropriateness of medications, especially the psych meds. They are reviewing the use of restraints, and they're looking at all the policies and procedures. They may review all the grievances, the abuse reports, and the account ledgers for all the patients who have a trust or a bank account held by the facility. They audit the doctor's orders and they make sure that they are being followed. They make sure patients' rights are being upheld and that there are appropriate activities available. They are also making sure that the facility's self-reported data given throughout the year has been accurate. And they are going to randomly say something like, give me access to these 20 resident charts. And the facility doesn't get to choose which charts. And the investigators are going to look at every single intervention of every discipline. The doctor, the nurses, the therapists, the dietitian, the social workers, and case managers. They are looking and looking and looking and digging to find an error that some staff did along the way. They could even look at the personnel records to make sure that background checks were done on staff and that licenses are all current. It is 100% nerve-wracking for the staff and the administration. It's probably the most stressful time of the year for everyone involved. The inspectors, they're given full access to absolutely anything they want in the facility. There is really no way for a facility to hide things from them. So when deficiencies are found, they are rated as minor all the way up to life endangering, and the facility is directed to make corrections in a really short amount of time and to show proof that they were corrected to avoid it happening again. In some cases, surveyors, they're going to come back out in a few weeks to check on fixes themselves. For facilities that had a lot of problems, that means the inspectors could be coming back out over and over throughout the next year. Based on their findings, this is how the ratings are generated for the 5-star system. So for people who say that the star ratings are bogus, for the most part, I have to disagree. But it is the best indicator we have for now. Next, I want to show you how you can look at the star ratings and other important information for facilities on the Medicare website. It's Medicaregov/care-compare. I'll go ahead and put a link in the description so you can find it later. But let me show you what the site looks like and how you can dive deep. So this is the Medicare Care Compare website. As you can see, you can compare lots of different kinds of care on this site. Hospitals and home health agencies, but we're going to focus on nursing homes, including rehab. So click here. And you can just put in your actual street address or your city and hit search. So as an example, I'm going to use Denver, Colorado. Okay, and hit search. So it's going to come up with, it came up with 91 nursing homes within 25 miles of Denver. Okay, so I just want to show you around this website a little bit so you can get used to it. These are the star ratings that I was talking about right here. I'm going to click on that. These ratings are made up of three different points. One are the last health inspections that I talked about earlier, the last one and the 2 previous ones. So 3 years worth of health inspections, 3 years worth of complaints against that facility, and 3 years of infection prevention issues. And then the next one is staffing, and the last one are quality measures. And there's 2 different kind of quality measures. There's short stay measures, which are under 100 days, or long stay measures, which are 100 days or longer. We're going to focus on the long-term ones. Okay, so let's dig in a little more. If you click on, for this particular facility, the inspection results, you're going to see a lot of information regarding the last time the inspectors went into that facility. So it tells you here what is the last date of their last inspection. This is always within the last year. It tells you the number of citations that were found during that last citation. And I want you to notice here where it says 7, the average number of citations for an inspection is 9.3 in the whole United States. The average number, it's telling you here, for this state of Colorado that I happen to be searching in is 8.4. This particular facility received a 7, which is pretty good. So it tells you here there were no complaints during the 1-year period. If there were, they would show you all the complaints over the last 3 years. And the number of facility reported issues, what that is, whenever there's an issue, unknown reason for an injury or a fracture or anything like that, if there's any reports of abuse, the facility is required to self-report to the health department. And then the health department can decide based on that self-report if they're going to come out and do an on-site inspection. So let's keep going. And then down here is information about their infection control inspections. When you go up here, you can look at the last inspection. So let's click on here. And you can see exactly what the investigators, or the inspectors, I should call them, found. So you can read through here. I mean, this one is 24 pages. You can read through here and see what they found. Okay, so I'm still in Denver, in the Denver area, and I wanted to show you how you can sort the data. So you can sort by 25 miles, from 5 miles all the way up to 200 miles. I know a lot of rural areas out there in the United States don't even have a nursing home within 25 miles, so you're going to have to expand your search. Okay, you can search for the ratings. You can search by the health inspection ratings, staff ratings, and other things. So right now, right here, I am sorted by the highest rated. Okay, so I want to show you in this area, out of 91 nursing homes, how many 5-star facilities there are. Lots and lots of 5 stars. Let's go to the next page. Okay, so 18 5-star facilities, and then we're at the 4-star. So a good third of the facilities are 4 and 5-star. And I'm going to go all the way down so you can see the 2-star. 2-star and 1-star. I want to show you something. There are a lot of 2-star and 1-stars. The same amount that there are 4 and 5 stars. So as we're getting down here into the 1-star facilities, I want you to notice this red hand. What that means is that this facility has been cited by the state for abuse. So when you get down here to the 1-star, there are a lot of them, unfortunately, that have been cited for abuse. Stay away from the 1 and the 2 stars, especially if they have this red hand on it. Okay? There are a lot of them. But if you noticed, in the 5-star and the 4-star, none of those have abuse reported. Okay? Because these are not the facilities that you're hearing about in the news. So I wanted to also, let's use this one as an example, Juniper. They are a 1-star facility, and I'm just going to show you some other things that you can look at in the reports. Okay, so if you can click on their fire and safety and emergency preparedness. They got 11 citations for their emergency and preparedness citations. So that's a big deal. You can, the average number in the United States is 4.8, and they got 11. Okay, so let me show you something else regarding staffing. You can look at staffing and see how their staffing stacks up to the average in the United States. So, like for this one, staffing hours per resident per day, the national average is 3 hours and 19 minutes, and they only had 4 minutes. They look like they're really short on nursing. It's really horrible. So they have 120 residents. That's a big facility. Something else, it will down here is to show you the staff turnover. This particular one is showing you that their administrator has turned over within the last year, which could be a red flag. If they can't keep staff, then you're going to want to also know, is this administrator someone who came from a 5-star place? Which I don't know why you'd move from a 5-star to a 1-star, but that could be a good sign that the place is going to take an upturn, but you just never know. Okay, so these are things to look at. So let's take a look at the quality measures. We are going to look at the long stay quality measures. Okay, so this tells you all the things that they're rating the long-term care residents on and how they scored. So you're looking at things like what % of their patients use antipsychotics. Nationwide, it's 14%. This facility was 68%. You know, these are things that you need to look out for. So you'll be able to find a lot of information. Let's see what else is here. Information on restraints. They were 0, so that's good. The national average of patients who are incontinent of bowel and bladder is 48% for long-term care residents, and this facility was actually lower at 31%. Percent have depression, percent that are on anti-anxieties or hypnotics, 20%, they're about the national average. So just giving you an idea of more information that you could find here. Okay, so one other thing I wanted to go and show you is a facility in Washington that I came across. So I wanted to show you this one, St. Francis. Not only do they have the red hand indicating they've been cited for abuse, they also have this yellow warning. What that warning is that they are rated so low they don't even have a rating. So like if I click on this, they have no rating because, here I'll let you read it. This facility is not rated due to a history of serious quality issues. Essentially, they are so bad of a facility that they're at risk of getting their license taken away. So definitely do not place your parent in a facility that you see these symbols. Okay, so, but let's go back. And I want to show you a nice 5-star facility. So let's choose this one. Just so that you have something to compare to, okay? This, let's look at their health inspections. They had 5 citations. National average is 9.3. And the state of Washington is actually bad. In general, 14.8 citations. This facility had just 5. Okay? They had no complaints. In the last 3 years, no complaints. And no infection prevention citations. The other things that I wanted to show you are some other things for you to consider are whether or not a facility is for-profit or non-profit. I know that a lot of times people say, you know, you got to use a non-profit because the care is so much better. However, there's only 22% of all those 15,000 facilities are non-profit in the United States. 71% are profit and 6% are government-owned. So I want to show you where you find that information. If you scroll down here, when you open it, it will show you who the legal owner is, the ownership type. So this particular one is for profit. You might find it say nonprofit here, or you'll see it say government owned. There is, for instance, a veterans nursing home here in California, And that one here says government owned. This map shows you what states have the majority of profit facilities. For instance, all the dark blue ones are 68 to 88% for profit. And this one are all the non-profits. So a couple of states, only 3 have majority of non-profit facilities, where most really don't have any. The other thing to consider as you're searching are large versus small facilities. Statistically, the smaller the facility, more likely you're going to have a higher rating. Not always, because I did find some highly rated facilities, but let me show you when you do a search. I can search for like all of Washington State. And I can search by the number of beds available. So if I search the over 200 beds, these are all the huge facilities. There is one that is a 5-star, but most of the, you're going to find overall a lot of lower. Let me do that for California instead. So for California, I'm going to search by the number of beds. So let me search by over 200 beds in California. And then I am going to sort by rating. So we do have here a few large, over 200 bed facilities that are 5-star. Let's see what else we have. And then they quickly go into the 2 and 1-star. Okay, so keep that in mind. Large facilities, it's really hard to keep track of all those patients and do a good job. Smaller facilities, you might find better care. You're also going to want to consider if they're close to a hospital. Most states are within a hospital or affiliated with a hospital. Many states, they don't have such facilities. In California and some of the bigger, more populous states, there are some nursing homes that are actually located inside of hospitals or are affiliated and close by to a hospital. When you have that opportunity, your parent could get help faster, especially with emergency care. There's better access to specialists, better communication when there's a hospitalization. You can also filter by within a hospital. Okay, so a 5-star within a hospital, I mean, those are terrific. And they tend to have higher ratings, look at these, because they have hospital affiliation. So yes, while there are many bad facilities out there, there are also a lot of good ones I hope you see. The 4s and the 5-star facilities. I recommend you steer clear of any 1 and 2-star facilities. 3s are right in the middle. And if there aren't any 4 or 5-star beds available, if it was my parent, I might be okay to have them go in a 3-star facility and then move them to a 4 or 5-star facility once a bed came up. It's the 1 and 2-star places that you hear about in the news, and you're not hearing about the good ones, but they are definitely out there. I worked in a long-term care facility for 14 years, so I've been through probably 13 inspections. It was a really terrific 5-star facility here in Southern California, affiliated with a hospital. It had a great administrative team and a director of nurses who was really on top of everything, and the staff were really caring and loving. The residents were very well taken care of, but you never hear about that facility because it's never in the news. So dig into that Medicare website, find a few places that you're interested in, and call for a tour. Ask them if they take long-term care patients, because some of them don't, and it's better if you find out before you drive down there. When you go for your tour, don't completely judge the place based on the decorations or how old the building is or how the lobby looks. Those are just not that important. But it should be clean. And now you know, don't just go for the facility that's closest to home, because you know that could be a disaster. So once you're at the facility and you're there for your tour, how is the smell? I do have to say, everybody poops and everybody pees at nursing homes, so you may get that smell sometimes, but it should be short-lived, and the smell should not just hit you when you walk in the front door, and it certainly should not permeate everything all the time. That would be a really bad sign. Are the residents just lined up in the hallways doing nothing? Ask to see the activity room and see if there are residents in there enjoying activities. You can ask if they have a hospital affiliation or how far they are to the nearest hospital. Do they have a resident or family council? And talk to family who's in the lobby and see how they feel about the place. Do not go into rooms and talk to patients. That would not be okay. It's okay to ask about the director of nursing or the administrator. Ask how long they've been there. If they've been there for a long time and it's a 5-star facility, that's really a good sign. They know what they're doing. But if they are new, ask where did they come from? If it's another facility, well then go on that website and look it up. If it was a 1-star, that could be a bad sign or at least something for you to consider. I recommend you do your research and tours before you ever need it. You don't want to have to do this research when your parent is admitted to the hospital and they're in the middle of a medical crisis. If you know about the facilities in your area, then you're going to be prepared for the day if a day comes that you need to make a decision. And if the hospital wants to send your parent to a facility that you already know that is a 1-star facility, then you're going to be prepared to say, oh, no, keep looking. Because they don't really care about the star ratings. They just want to get your parent out when they're ready for discharge. And a 1-star facility, they probably have beds available, surprise. So it makes the job of the discharge planner really easy, but don't fall for it. Actually, if your parent is admitted, be proactive. The first time that you speak to a case manager or a discharge planner or social worker, whoever will listen to you, tell them ahead of time, if my mom needs to go to a nursing home, these are my 3 choices. Give them your list. Get ahead of them. Okay, friend, now you can consider yourself to be educated in nursing homes better than 95% of the population. Do not be swayed by the news headlines. If your parent needs long-term care nursing, and there are good facilities out there with good caring staff, and they are well run, now you know how to find them. If this video is helpful for you, give it a thumbs up. Go ahead and subscribe so you don't miss any new videos that are here to help you reduce your stress over parent care. Thanks so much for watching today. I'll see you next time.